So hello, my name's Adrian Richards. I'm a consultant plastic and cosmetic surgeon, and I'm the surgical director of Aurora Clinics, which is based here in the UK. So today I'm going to be talking about gynaecomastia. This is a condition basically characterised by excess prominence of the breast tissue in men. Okay. So now what causes it? Well, there's a number of causes of it. Often happens in puberty and very old age. In puberty, it's often due to sort of hormone balances, and normally, in nearly every case, if anyone has gynaecomastia in puberty, we would encourage them to wait until they're at least sort of 18, 19, even 20 after puberty age, because a high proportion of the patients with gynaecomastia, it completely resolves after this stage. Now, if it does remain after the age of 20, we need to look at some causes for it. Most causes, most people have it as a sort of unknown. There's no particular cause for it found, but a certain percentage of people there will be a cause. And the causes are obviously being overweight, marijuana smoking, some drugs such as cimetidine can cause it. So, have you got any of those sort of risk factors? If you have, steroid use, particularly for sort of weight builders, that can increase it. So any of those can cause it. But as I said, most cases are what we call idiopathic, and that's just the posh medical word for saying there's no particular cause. But it can run in the family. So if you've got, uncle, father with their gynaecomastia, you're more likely to get it. Okay, so why have you got it? You might not be overweight. In fact, most people with gynaecomastia aren't particularly overweight. That's the area you tend to put fat down. So we all need fat stores, and some people put it in their chest, some people around their tummy. So we've all seen, overweight people, football supporters, in the crowd with their top big, enormous beer bellies, but no gynaecomastia. It's just they don't put down fatty tissue in that area; they tend to put it in another area. So if you've got gynaecomastia, it's just unfortunate that that's where you tend to put the fatty tissue down. Okay, I often see patients who've got gynaecomastia and they've tried to exercise it away by doing press-ups, bench presses, chest exercises. Now unfortunately, while this actually makes the pectoralis major muscle, main muscle here, stronger, it doesn't affect the tissue over the pectoralis muscle. In fact, it can make it slightly worse, in that if you really exercise with bench presses, you make the pectoralis muscle thicker. So you're actually pushing the gynaecomastia forward and you're making it worse. And it said it won't have any effect on the fatty tissue above it. So if you're doing loads of bench presses, exercising the muscle, probably best to stop. Exercise everything else as normal, good aerobic exercise, good weight loss type exercise. Keep your weight down, not too much exercise on the muscle, and that's probably the best approach initially. Now if the gynaecomastia remains after that, you get down to a healthy weight, really we need to explore options of how to treat it. So I'm going to be talking in the next subsequent video about how we reduce the gynaecomastia and the surgical options for it. So thanks very much for listening. If you'd like any more information about gynaecomastia, how it's treated and the best way forward for you, please contact us either via the website, which is auroraclinics.co.uk, or email, or just phone us on the UK number 01844 214 362. Thanks very much.